Yeah, what's going on? This is Jackie, and today I'm making a video titled "What Really Goes On in Hospitals?" Buzzfeed edition. So I saw this article, and it was on Buzzfeed, and the article is 30 secrets and confessions from people who work in hospitals about what really goes on behind the scenes. Y'all, this this thing it tells it. It tells what's really going on, and so we just gonna go through it one by one. So the first is this is a person who's a surgeon. It says we listen to music in the operating room. Most people seem surprised when they hear that. I am surprised when I read that. Yeah, I was like, yeah, that is surprising, but it makes sense though. I never been in the operating room as a secretary. I did have an opportunity to watch a surgery be performed, but by the time we got there, by the time we got gowned up and everything, they were ending the surgery. So they were putting the heart back in because it was an open heart surgery. They were putting the heart back in the body, and the surgeon was stitching it up. But and plus we weren't actually inside the operating room. We were in a room looking through a window watching them. So but yeah, I'm surprised to hear that because I wouldn't think they would be listening to music. But you've done it. How many times you done open heart surgery? You just in a zone. So yeah, that makes sense. But yeah, I was surprised. And then let's see. Number two, not hitting per se, but for the love of all that is holy, if you insist on bringing your kids into the hospital, do not let them crawl or play on the floor. The amount of blood, urine, poop, and vomit that has been on it and cleaned up is a lot. And it says the hospital, especially the floor, is not a clean environment. That is 100% true. Yes, you see housekeepers cleaning. Yes, you see staff cleaning. But yeah, it's a lot on the floor. Like um, a lot of people who work in the hospitals, like when they get home, they the shoes that they wear around, so the shoes they wear to work, they don't wear in their house, or they have it in a certain spot. So my mom was a nurse. The shoes are in the garage, right? So we come in through the garage, the shoes are in the garage. Sometimes if it's one of those nights, it gets cleaned. It gets washed by itself. We put it in the bag, wash it, you know, and then you know, and sometimes the shoes be at the front door. Okay, it's just like it's one of those. But yeah, we don't walk around the house in the shoes that you wore to work, right? And usually when you get home, you should take a shower because a hospital is very nasty, you know. Um, yeah, a hospital is nasty. Let's just put it like that. Yes, you see stuff being cleaned up, but that doesn't mean anything. I mean, the amount of blood, people were just bleeding and having blood transfusions, and if they're bleeding and we're trying to stop the bleeding, so like just from speaking from the ICU, if they're bleeding and the towels, they're bleeding all over the place. You got the sheets and the blankets and the towels. All that is getting all that is being soaked up. We're soaking the blood up with that. We're not going to send that down to be washed. We are throwing the sheets, the blankets, pillowcases, towels. We're throwing all that in the garbage because that's like you ain't gonna get all that blood out. You know what I'm saying? And then if it's so much blood, because you leave, if we got that going on, by the time we go to take the garbage bag out the garbage can, we can't carry that. Okay, so we're dragging that. We're dragging it because it's heavy. Because blood is heavy. So you got all this bedding and towels and stuff that's soaked in blood. You can't carry it, and so we're dragging it across the floor to the dirty utility room, so it can be thrown in the garbage. So now you got a streak of blood going from the room to the dirty utility room. You know what I'm saying? So it's going down the way. Yeah. So yeah, don't let your kids be crawling on the floor. I mean, children shouldn't be in the hospital anyway. Like I know grandma in the hospital and everything, but little kids should not be in the hospital because they want to crawl, they gonna fall, especially like little babies, they gonna fall, and then their hands gonna be on the floor. So, and then of course you got people who bring in animals, and it's a lot. And we didn't even talk about the urine, people pooping and all, and the vomit. We didn't even talk about that. But yeah, the floor, yeah, no, yeah, no, leave your babies at the house. And oh, let's move on to the next one. Number three, when your doctor says, I'm going to check your chart, leaves, and then comes back, we're almost certainly checking up to date paywall. So basically, I didn't know this, but usually it seems like it's a Google. It's like they're going to go look up what your condition is or what that means or things like that. That's what it sounds like to me. I never heard of that, but that doesn't mean anything. Number four, if you sit there on your phone the whole time the mother of your child is in labor, such that a nurse has to step in and fulfill the supporter role instead, everybody knows. Yeah, everyone knows, and you're going to get judged by the whole unit. So basically, it's just talking about when a woman is in labor and the father is on the phone. Yeah, they gonna talk about you. That's basically what's gonna happen. Yeah, they gonna judge you. Let's see. Number five, there is sex and drama, but not the Grey's Anatomy way. More of an overgrown high schooler shoved together in a really stressful situation. So, yeah, there is sex and there is drama in hospitals. The stories I could tell you, okay? Um, the one that comes to mind like right away is in the ICU. It was in 2017, I think it was, when Hurricane Irma hit Florida, because first Hurricane Harvey hit Texas, and then Irma hit Florida, and then Maria hit Puerto Rico. So when Irma hit, we were in the hospital because I always signed up to to work during a hurricane. So I will always be at the hospital during a hurricane. And one of the nurses in ICU, she was messing with one of the surgeons, the heart surgeons. Okay, and I ain't pay no attention. She was in one of the rooms because, of course, one of the things you do when you go in the hospital is they try to clear out the hospital so it get everybody that can go home, send them home, and only keep the patients that really actually need to be in the hospital. So the hospital is for the most part empty, right? I mean, you do have patients there, but for the most part it's empty, and so it's just the ones that's locked in because we're locked in. Like nobody's getting in, nobody's getting out, except through the ER, right? And so she was in one of the rooms and she was upset about something, but I didn't pay no attention to it. So here it come months later, all this drama going on, and they was like, "Well, don't you remember, Jackie? You was there during when we were locked in during the hurricane." And I was like, yeah, I was there, but I didn't know, why she was upset." Come to find out, she was upset. The nurse was upset because she was messing with the surgeon, but the girl upstairs on our sister floor was messing with him too. Because some kind of way she overheard the girl describing his bed and how his room was, so she knew the girl had been in his room because of how she described it. And so that's why she was upset. So she found out while we was all locked in the hospital. And the girl was there. The girl was upstairs because we were all locked in. And so the girl was there, and I guess the charge nurse was trying to keep her from going up there and trying to fight her. And then number six, there's an army of physicians in the basement that approve every medication entered by every doctor, frequently catching errors that need to change in therapy. So basically, you have doctors who will come in and write an order, like say for you to take this milligram, every 8 hours or something like that. But it conflicts with what another doctor wrote, or it conflicts with something else, okay, or something you might be on like your home meds or things like that. So the pharmacists, they catch that. That's what they're there for. They catch it. So just because a doctor orders something doesn't mean you're gonna get it, because it might conflict with it, and then you'll die, and then you got problems. You know what I'm saying? A lot of medical errors, things like that, are saved by the pharmacist. And number 7, I work in the lab. I legit get attached to some of my patients through their charts, especially the ones with longer or frequent visits. I remember their names after seeing their specimens come through the lab day after day and get familiar with their history and hospital course. I get sad when they die and happy when they get better and are able to be discharged. I have no idea what any of them look like, and most of them will never even know I exist. So, you can, what, like me personally, I'm very familiar with names because as a secretary, you sit at the computer and you know the patients by their names, right? Now, don't ask me for no room number, but I can tell you their name. Okay, 2 years later, I can tell you their name. Yeah, you do get familiar with people, and you do learn things about people just from a little bit that you see. Now, the fact that they when they see the names come through on the specimens or on the blood or the that's kind of weird. I mean, I don't know how much the lab tech has access to your information because the only thing they would know is your name, your room number, like your medical record, and you know why, like what, if they're testing blood for what reason, like just for CDC or things like that. I don't know if they would have access to why you're there, your diagnosis. So I don't know what they have access to, but yeah, you do get familiar by the name and just a little things about people. That does happen. And let's see. Number 8. When nurses and doctors are laughing and joking with each other, it is a coping mechanism. We aren't trying to be rude. We are compartmentalizing the trauma that we see all day, every day. If we didn't lighten the load, we would cry all day and never come back to work. It's literally the only way to watch a baby die and then deal with a screaming Karen next door without punching them in the face. Yeah. So when you see nurses and doctors and staff laughing, yeah, and you be like, how can you be laughing? My mom is, you know, you're at the nurse station laughing and talking. My mom is, because that's how we deal with it. It's nothing personal. I mean, um, we do get sad when things happen, but yeah, that's how we deal with it. That's all. Let's see, number 9. When nurses are sitting at the computer doing nothing, they're documenting. In healthcare, if it isn't documented, it didn't happen. That means every single patient interaction needs to be documented as well as interactions with the doctors, pharmacists, etc. That is true. Yes, if it is not documented, it did not happen. So if they say they gave you medication and it's not documented, it did not happen. So yeah. So when you see them sitting there, they're just documenting your care. And wheelchair jousting with towels wrap crutches does happen on some nights. So they just saying, just joking around. That does happen. Most of us don't judge as much as you may think. As for myself, a former professional, I don't care what drugs you take or how much you drink. I just want the truth so I can provide the best plan of care for you. For example, if you're an alcoholic or addicted to benzos, I need to know to prepare for possible withdrawals that can become deadly. Exactly. People, like we've seen everything. So my mom's a nurse, and she was like, I've seen every penis. Okay, I'm like, wow, like what I'm saying? It's like it's nothing. You know what I'm saying? It's nothing. You seen vaginas. Okay, it's nothing. And so, and if you got diseases or whatever, you ain't the first. You ain't the first. If you got a disease, a STD, let's say, you are not the first, okay, and you will not be the last. And half the time, people don't even care about that. Like, let's see, 12. Nurses often don't get 30-minute lunch breaks or 15-minute breaks or bathroom breaks or water breaks. There have been many 12 to 14-hour shifts. I worked in the ICU where I went to the bathroom one time and didn't drink any water. Oh, and I inhaled my cold lunch in under 5 minutes if I was afforded the opportunity. So this is true, but not true. Okay, so everyone gets a break, but a lot of the nurses don't take their break, right? they get a 30-minute break. Everybody gets a 30-minute break, but a lot of the nurses don't take their break. I suggest everybody get their break, but the nurses don't take their break, and that's where the issue lies. Even so, when I worked on the med surge floor, even when the nurses had uh, lunch buddies, so meaning when nurse whoever went to lunch, she would give her phone to this nurse. So that nurse would have her patients, and then she would have the phone for the nurse that went to lunch. And that way, the nurse can have lunch without being interrupted. She can have a 30-minute lunch. But the nurses don't do that. So the nurse may go to lunch, may go sit down and go to lunch, but she still has her phone. She's still answering her phone. She's still doing all this. She's still, and then you have nurses who will sit down and they eat their lunch while they're charting. So it's not that you're not giving a lunch. A lot of nurses don't take their lunch. That's what it is. And then as far as bathroom breaks, yeah, they don't pee either. And let's see, number 13. Just because a person seeing you is professional in the room about your weird issue doesn't mean they aren't walking out of there and telling other staff members about that person that slipped on a bottle and it went into their ass. No names are used to avoid HIPAA violations, but chances are within an hour the entire floor will know about it. Yeah, people be talking. Okay, if people be talking. Okay, be knowing some weird stuff. Okay. Um, 14. As an x-ray tech, I can't tell you what's wrong if you ask me if I see anything on your x-ray because that's not in our scope of practice. But yeah, we definitely know. And if it's particularly gruesome, we like to show off how pretty our images came out to other techs. So, yeah. It, so just because the x-ray tech, yeah, they can tell something's wrong, but they just can't tell you because it's the doctor. The doctor is the one that's supposed to tell you. 15, you can refuse treatment. If you don't want to take medication or have a surgery or any other type of medical treatment, you can refuse. I will never forget talking to a 90-year-old lady who didn't want a procedure but didn't realize didn't have to do what the doctor told her. She was mentally competent and just didn't know she could refuse. Your body, your choice. And that is so true. That is so true. I did that once. I they when I had my when I was in the hospital, the doctor wanted to give me a certain medication. I'm like, I'm not taking that. You're gonna have me because it was a narcotic. I'm like, I'm not taking that. I've seen these patients come in here and they get addicted to these medications. So no, I'm not doing it. Like number 16. It says, I deliver blood to hospitals. Most patients don't realize the blood supply in the U.S. is at critical levels. There have been a couple of nights recently where a hospital calls for more blood of certain types, and I've had to tell them we can't fill the order. We just don't have the product. It's the holiday season, and people don't have the extra time to donate. I work in a rural area where the next hospital might be an hour or more away. And that is true. The blood supply is low. And let's see. Number 17, the bathrooms by the admin office across from HR are the cleanest and they're also open to the public. It's worth the trek across, especially at night. So yeah, usually the bathrooms by HR are clean because you have people going in there and out of there every day, so they keep those extra clean. And then also the bathrooms by the administration office, they're usually clean because people don't really go over there. And let's see, and of course they keep it clean for administration. You don't want dirty bathroom by the VP or whoever. Let's see, 18. Check your bills meticulously. I've seen lots of random equipment stickers on people's charts that made no sense and were clearly mistakes. Always check your hospital bills. Oftentimes in hospitals, the morgue and the cafeteria are next to each other as they both require massive refrigeration units. So I actually in the hospital, the cafeteria and the morgue were far apart. They were on opposite ends of the building. They both were in the basement. And for a long time, I didn't even know where the morgue was. I never even knew where it was. But yeah, and the morgue was small. But I can see why they would be near each other. But yeah, that is kind of gross. All right. Depending on how nice you are to staff will impact how quickly they respond to your needs. If family or patients are mean, we hesitate to go into the room because we don't want to be yelled at. Also, don't film us doing our jobs unless you like us to come to your work and film you. And that is so true. The nastier you are, the more staff roll their eyes and they don't even fool with you. Like you gonna wait. That's basically what I'm saying. You gonna wait. You yelling and talking to your family is if your daughter is and you are and you on a call light all day and you're calling and you gonna wait. Okay, you're gonna wait because we know by the time when we do get in there, we're gonna be in there a good 10-15 minutes with you, listening to you fuss about nothing. Okay. And 21. Sometimes when people die, we just put on oxygen masks. We just put an oxygen mask on them and wheel them through the corridors, less distressing for other patients and visitors to think they are asleep rather than see a body covered with sheet. You know what? This right here never dawned on me, but that does make sense. So if you have a person that's dead and you're taking them to the morgue, just put an oxygen mask on them. That does make sense. Number 22, physicians spend over 5 times more time discussing your care and speaking with specialists than the time we spend in the room. Just because we only see you for about 5 minutes every day doesn't mean that's all the work we're doing for you. And that is correct. So the doctor might come in and out, but I guarantee you they're sitting at that desk charting. They're talking to other doctors on your case. They're calling other doctors. So like say you got your hospitalist, you got a cardiologist, and the cardiologist is there. So they're both there at the same time. They will be sitting there talking about your case. They're charting on your case. They may call the other doctor and talk about your case. So yeah, that does happen. And that's usually what's going on. So don't think just because they saw you for 5 seconds they're not talking about. No, they are. They're discussing your case. And let's see, 23, hospital lab worker here. Not particularly scandalous, but most people don't realize their lab tests are just very accurate guesses and have an error range. When we say your X is 10 grams per liter, we might actually mean 10 grams per liter plus or minus 10 or 20%, which is true. If you ever get like any of your medical records and you look at your lab results, it falls within a range. So that's how they can say, oh, your labs are low because it's within a range. So it could be, like, so let's say 0 to 50. Your yeah, if it's 0 to 50, that means it's low. But if it's 50 or 100, between 50 and 100, that means it's high. And it came in at let's say 25. So that means it's low. But it might not be 25. It could be 13. You know what I'm saying? So yeah, if you ever look at your lab results, it's always in a range. Number 24, July at a teaching hospital is the worst month to be a patient. New residents usually start in July and is mayhem. And that is true. Doctors are judged as good for wrong reasons most of the time. Patients love a doctor who is like a salesman, someone who says everything is fine. And other health workers, including doctors from other areas, don't necessarily understand enough about that specific area to decide which doctor is good. This means sometimes only a cardiologist knows which cardiologist is good, and other people, including other doctors, don't. The worst advice about which doctor is good comes from other patients. So basically, what they're saying is that you have doctors that people say, oh, that's a good doctor. So and so is a good doctor. But you, the, so like, okay, let me back up. So let's say you need a cardiologist and your primary care doctor says, oh, so and so is a good doctor. Well, so and so your primary care doctor doesn't know about cardiology. So they don't know that the doctor that they said is a good doctor is really a good doctor. They don't know because they don't know about cardiology. So what this is saying is that only a cardiologist knows if another cardiologist is good. So basically saying that people are said to be a good doctor by people who don't know if they really are a good doctor. Only a cardiologist would know if another cardiologist is a good doctor. Okay, I know that's kind of confusing, but that's just the way it is. Healthcare workers, let me tell you something. Your nurse knows who the good doctors are and who the bad doctors are. Okay, a nurse knows, a secretary knows, we know, but another doctor may not know. Your primary care doctor does not know that so and so is a horrible doctor, horrible cardiologist. They don't know that. The nurse knows, the secretary knows, but your primary care doctor does not know. Okay? Your nurses know. And if you ask a nurse, is so and so a good doctor? Like, let's say you're going to have surgery, and you ask the nurse, is so and so a good surgeon? They're not going to answer that question. Okay? They're not going to answer that question. They might say yeah, he's a good doctor. But if he's not a good doctor, they're going to stare at you with a blank look and just not say nothing. Okay? So I'm just letting you know. Let's see. Number 26. If you are insured and have a high out of pocket deductible, copay, core insurance, and are low or lowish income, ask for the financial assistance forms and send those in. In nonprofits, at least, there may be a good chance that you can get your out of pocket portion reduced or even forgiven. Just because you have insurance doesn't mean you don't qualify for financial assistance from a hospital. Either way, it costs nothing to request it, and the worst that can happen is they say no, and then you ask again. So yeah, always ask for assistance. 27. I've been working on the facility side of hospitals as an outside contractor for 10ish years. You will be amazed at how many people I find hiding from their work in unlikely places that they think people won't look. I walked in on nurses sleeping in mechanical closets, facility guys hiding in mechanical rooms, doctors playing Game Boys behind equipment, LOL. I like to hide from work too, but I kid you not, today I walked in on two people hiding in separate mop sink closets. And that does happen. All right. And number 28, I work in the healthcare information management. So that's like medical records at a small hospital. So I'm not really anyone important. I hate that the process to obtain your medical records can be tedious. But oh my goodness, you would not believe the amount of people that try to find out about other people's detailed medical records, random family members, friends of the patient, etc. I even had a guy call stating he started dating this woman and wanted to find out if she had ever had any major medical problems he should know about, then screamed at me because I wouldn't tell him anything. So, um, I was actually surprised to hear that people actually call down the medical records trying to get people's medical information. I was surprised to hear that, but then I thought about it, and I'm not surprised because, as a secretary, we have family, want to know how it goes far beyond how a patient is doing. Okay, so if you have like let's say your mom is in the hospital, right, and your mom is up there, but she's alert, she's up in age, but she's alert and she's orientated, she knows who the president is, she know what year it is, she know where she's at. If she's one of those, if you call the desk and you want to speak to the nurse to find out how your mom is doing, um you gonna get some information, maybe. Depends. You didn't get nothing from me. I just want you to know that. But you might get, oh, she's doing good, blah blah blah. And then they say, oh, I can transfer you to the room, and how you speak to your mom. Because your mom is alert. Your mom is orientated. Your mom knows who the president is. Your mom knows where she's at. She's alert. She can tell you. Now, there's some things your mom, might not be able to tell you. She might be able to tell you, I'm going down for a procedure, but I can't remember, So maybe, the nurse will be like, yeah, she's going to have, an x-ray done, things like that. But if your mom is alert, You're not gonna get too much information. And then, and plus, it's HIPAA. And then if your name is not on that chart for them to give you any information, you're not gonna get any information. So, we just don't go giving out information just to random people. And look, you ain't gonna barely give out information to the family, especially if the patient knows what's going on. Now, we will have people who will speak to the patient. The patient is fine, and they will, but the patient doesn't want so and so to know their business. So, like, let's say it's some family dynamics going on. The patient is fine. They're speaking to their sister. So let's say it's your mom and she's speaking to her sister. Her and her sister don't really get along, but the sister found out that she was in the hospital. So the sister called, and your mom tells your sister some things, but she don't tell her a lot of things, right? Because they really don't even get along. They really don't even like each other. So then the sister will call the nurse station and want to get more information. See, that's when we refer you back to your sister, the patient. We're not gonna give information because it'd be family dynamics going on. It'd be a lot of family dynamics going on, and so yeah, you ain't gonna get no information. Like, let's see, number 29. In every lab or pathology area, there is a cabinet or closet that contains items that were removed from someone, be it a pacemaker, hip joint, light bulbs, dildos, very large zucchinis that broke in half and got stuck. We need to keep some objects for safety reasons, lawsuits, recalls, etc. Then we keep the more interesting things for the newbies in the lab. Okay, so yeah, I'm not surprised, because yeah, there'd be a lot of interesting things going on in these hospitals. And finally, we actually really care about you. You aren't a number to us, and when you have an unexpected outcome, we grieve and have to support each other and have care conferences to process our feelings. Sometimes we even need some time off of work to emotionally recover. I never knew how much doctors and nurses really care until I became one. And that is so true. Y'all, when someone dies, the nurses cry. Okay, don't think it's just your mother died and we just sitting out there. No, your nurse is probably in the bathroom. You don't Do you see the nurse? No, she's probably in the room in the bathroom crying. She's probably in the break room crying. I've had to do that, and I'm just secretary. So y'all, that's all I got for you. Are you surprised by anything I mentioned in this article? All these comments about what goes on in a hospital. A hospital is just, it's a lot of personalities. It's never a dull moment. Never a dull moment in a hospital. Never a dull moment. So that's all I got for you. If you got any questions or comments, you can put them below. Don't forget to like the video, share the video, subscribe to the channel. And I'll talk to you later. Bye.